Hi, my name is Joshua Goldstein, everyone's favorite acupuncturist, and in today's segment, we're going to talk about headaches. Headaches can affect many different people, and there are many types of headaches. Today, I'm going to go into a case study of someone who I treated, where we got the headache and also the root problems of this headache, as well as other causes of headaches. So, I wanted to share with you a case of a 30-year-old high school teacher, female. She would get headaches that were diagnosed as tension headaches, which are headaches that slowly build over time. And she would get them to the temples. She'd get them to the back of the head. They would occur once to twice a week. They would last until she took a pain reliever, or she would have to get some sleep. She was sensitive to sound and sensitive to light. She did not get an aura, as many people do with certain types of headaches. The intensity of pain that she had was a 5 to 6 out of a 10, and it could last from 30 seconds to the whole day, or until she took a pain reliever. She told me that her difficulty was she had to modify her life. She had to reduce her workout. She had to stop using weights. She had to perform fewer chores so as not to aggravate the headaches. She also would aggravate her shoulder when she drove, as she has a stick shift and she needed to shift with the right arm. She's used Advil. She used massage. And the big thing here, and I'll get back to this in a minute, is that she did have a history of neck herniations, which means the vertebrae in the neck were herniated in the cervical areas, which were a big cause of her headaches. So we use different types of acupuncture to treat on 3 levels. And the name of the game of acupuncture, it helps to vasodilate blood vessels in headaches due to certain hormone triggers. Blood vessels can get constricted. The microcirculation in the head, those blood vessels constrict. And what we need to do is to open it up and keep it open so that they don't slam shut, causing you that throbbing headache and pain, and to keep it open. So her treatment, we use points to actually treat the headache. But if we just treated the head up, we were not going to make a longer lasting change with her. And so we also had to deal with the root of the cause of the pain, which I said earlier had to relate to those herniated discs. So when I treated the headaches and I used headache points, I also used points to reduce the nerve pain caused by the herniations in her neck. Additionally, she had a lot of tight muscles in the shoulders, and we had to reduce that pain as well. And then fourthly, and this was an interesting twist, she was an occasional asthmatic. So if the weather got too cold or the weather got too pollutant, like we have with the Canadian fires, she would get migraines. And so what we did was we would also use points to help send blood flow to the lungs, to help dilate the lungs so that she would reduce her wheezing. Because when people start wheezing, they start cramping up and getting tight in the neck and the shoulder area. So that's what we did in order to treat her. I treated her for about 4 months, and she did amazing. And then we gradually backed off, and she comes in now for some maintenance. What are other causes of migraines? Well, you have to look at, you can treat the head, but you have to treat the neck muscle spasms. You have to look to see if the patient has what we call in Chinese medicine blood deficiency. Blood deficiency is basically that the blood volume in the person is chronically low. So maybe at some point that person has had anemia, or that person had lost a lot of blood due to excessive bleeding, or from a trauma, or from a gynecological type of condition. That type of person would also look very pale, have cold hands and feet, and would also would just have a very pale complexion. In those cases, we would have to strengthen the body as well as treat the headaches, because she's not getting enough blood flow to the head, and then those blood vessels will constrict. Other people would suffer from sinusitis, which can cause frontal headaches, Hormonal issues are a big cause of headaches, and especially with estrogen. Estrogen in women can fluctuate during their cycle, and that can cause havoc, causing headaches. Men and women can be affected by having too much serotonin released, which is a feel-good hormone, but in excessive amounts can constrict the blood vessels. Yep, they can. And those blood vessels can get very, very tight. And as a result, you can get a headache. So dealing with stress, regulating serotonin, should we say, because we don't want to get rid of it, will be the right amount. If a person is having high blood pressure and they're taking high blood pressure medication, we would also add in acupuncture to help affect the blood pressure by dilating those blood vessels and encouraging relaxation and stress reduction. If other people have eyesight issues, and so we need to deal with the visual causes of the migraines, and other people have a nerve-like pain, like is in a condition known as occipital neuralgia, where there's nerve pain causing headaches. So we would need to address the nerve pain as well. What I'm trying to say here is we can't just treat the symptoms of the headache. We would also need to treat the underlying root cause of the headaches. Now, why do people come in for acupuncture for headaches? One, it's non-invasive. Number two, we don't inject any medication in the body. Number three, it works with the body's circulatory system to dilate those blood vessels and get that vasodilation to the small microcirculation in the head. And number four, people like to come in because it also shuts down the nerves of pain. So if there's a nerve affecting the headache, just like in back pain, we would actually treat the nerve to quiet it down. So there'd be less of that firing into the head, causing the headaches. So I invite you to call me or to come in or to speak with me on the phone if you have a particular issue or question regarding your headaches. I feel that whether you come to me or someone else, I think, acupuncture can be a very good adjunct therapy to help you in the treatment of your headaches. Remember, we don't always control what happens to us, but we can control how we adapt and overcome and try to adjust that as much as we can. You can call me at 201-444-7150 or check out our website at Acupuncture, yes, that's YES.com, and fill out the form. Looking forward to hearing from you. Thank you so much for watching and wishing you the best in your health journey and recovery. Thanks for watching.